the basis for us doing this particular study is to understand whether we can look for these early signals of potential cancer in these colorectal patients. In colon cancer patients, we found that with the symptoms, the earliest symptom to increase was rectal bleeding. So that increased from about 10 months before they were diagnosed in the end. And that's then followed by a change in bowel habits and abdominal pain, which increased from about 8 months prior to diagnosis. In rectal cancer patients, rectal bleeding, again, was the first one to increase from baseline. So that's about 8 months as well. So both these cancers had, there were symptoms that we would consider to be alarm symptoms. And they increased very early on before they were diagnosed. With respect to the blood tests, we also found evidence for early rise in the baseline rate of them becoming abnormal. So it seems to be that overall there is all the relevant clinical features that we looked for were increasing fairly early on before diagnosis, at least between 8 to 10 months before diagnosis. So whether there is something we could do in that 8 to 9 months in a more timely fashion, or whether there is additional monitoring or safety netting that we should be doing in the 8 to 9 months if they don't fit any referral or testing criteria. These are questions or things that we should be thinking about as clinicians. The benefits of this type of study is that we can view the findings in different ways. And the first is maybe looking at how long it might take for these two cancers to develop following an abnormal blood test or relevant symptoms. So it's to think about prospectively how long maybe we should be having an alert or an alarm bell going.